Is it painful after the surgery?
A lot less than most patients think it's going to be.
Okay, because I would think it's very painful.
It's actually not. So there is a little bit of discomfort associated. Most patients describe it as just a feeling of pressure in their chest. I do keep them comfortable with pain medicine. Usually they need to take that probably for about 2 or 3 days. But my average patient goes back to work in about 3 or 4 days. It's not a bad recovery at all. When the surgeon is very meticulous in opening the muscle, just going fiber by fiber, being careful to avoid any bleeding in the space around the implant, that really leads to less inflammation, less trauma, and less pain.
So when can they go back to their normal life, if you will?
So I let people go back to the gym at a month and start out with low impact cardio and leg weights, and at 2 months is when I let them start doing upper body again.
Fantastic. And go back to work?
Usually about 3 or 4 days, as long as it's not a strenuous job.
Not too bad at all. And any tips to make the recovery process easier for a woman?
So basically, just listen to your surgeon's instructions. You know, we give very detailed instructions as to step by step what the recovery is going to be like, what to do, what not to do, and that really makes the recovery go a lot smoother. Nobody likes uncertainty. People like to know exactly what I'm going to feel, how I'm going to feel it, and how long is it going to last.
All right. And the recovery for breast augmentation, is it comparable to breast lifts?
It's about the same. A breast lift has a little bit longer recovery. I usually tell people to plan on taking about a week off of work for a breast lift.
Okay. Any last-minute thoughts that you would have on someone who may be interested in doing this surgery, is kind of like on the fence, not sure?
So do your research. The American Society of Plastic Surgeons website is a great place to start. There is a ton of great information there, videos before and afters, and then of course they have the surgeon referral program where you can see which of the member surgeons in your city are close to you, because ultimately if they are a member of the American Society of Plastic Surgeons, you know that they are board certified and they have received the proper training and credentialing to do your surgery. And then find a few, go to their website, see the before and afters, compare the results, look at their reviews, talk to patients who have had surgery with them, and go to a couple of consultations and see who you most feel comfortable with, because ultimately it's a partnership and you need to feel comfortable with that person, trust them with your life and with your breast.